We're going to move into some lower body work. I'd like you to grab the ball to place under your head if your hamstrings are tight. And you're going to grab your second to heaviest Theraband. And this with the YouniquelyFit set is our blue Theraband, long Theraband, and our small anti-burst ball for the head. You can also use a pillow or a yoga block if the ball's too high and causes discomfort. If you happen to have open hamstrings but you still have flat back, then you don't need the ball. You can rest your head on the floor. Start with your dominant leg. Your dominant leg is the same side as your non-dominant arm. So we work in opposition. So right-handed, right leg, left-handed, left leg. And we're going to breathe here. Oh, I said that wrong. I'm sorry. So dominant leg is the opposite leg of your dominant arm. So if you're left-handed, which I'm left-handed, that's my right leg. If you're right-handed, that's your left leg. Let's all move into that stretch. The reason we start with the dominant leg, both in flexibility and strength, is we want to spend a little longer on the dominant side flexibility-wise, and strength-wise, we actually want to do less repetitions on that side, but we always want to start on it because our muscle memory will translate to the other side, so we can improve muscle imbalances and we can help that weaker side catch up. So the foot is dorsiflexed. Watch out for the back here. Tip your tailbone towards the bottom of the mat. You can take one hand under and check your low back out. How's it doing? Are you maintaining a little bit of space between the low back? If you're not, that means you need to lower the leg just a little bit. It may be a little too high. And if you don't have enough band, like if your leg is that far away, you can always put a loop band around the foot and then take the band through it to create a longer lever for you to control. Be where you are right now, hearing that breath, opening up the posturally tight hamstrings. After 2 more inhales and exhales, bend that knee, slowly bringing that leg to the ground, and let's switch sides. If you're experiencing back discomfort here, you've got to pull the abs in towards the spine, and you must use that Darth Vader-like fog and mirror sound. On your exhale, we've got to work that TVA. And you need to be conscious of where your pelvis is in space. The chronic pelvic flexion is what's causing the low back issues, the overactivity of the hamstrings and calves. So once we can learn to work in neutral pelvis, we can recruit the quads and hip flexors so we balance out that leg chain. So we've switched legs by now. Go ahead and switch if you haven't. And let's catch up on this side. I often will hold the band with the opposite hand as the leg that's up and take the other hand to the hip to make sure I'm not hiking the hip of the leg that's lifted. And that sometimes helps you check your form out. Keep your foot flexed. Hear your breath. So with flat back posture, we have a lot of flexibility issues that hinder, more than anything, they have you run the risk of injury, because you do have a lot of strength ability. So we've got to balance that out. And that means more time doing active and static stretching than actual strength work. Go ahead and take that leg down, set the band to the side, and I'd like you to grab your second to heaviest loop band to assist with our piriformis stretch. Again, you can have that ball behind your head if your outer hips are tight. And that's the purple band in our set. We're going to lie all the way back, and it's going to go around the thigh of your non-dominant leg. So the same leg as your dominant arm. It goes around that thigh, and you're going to hold it, and then you're going to cross the leg that doesn't have the band over top of the thigh. There we go. And dorsiflex the feet. And now you can take your wrist through it and create a fist to hold it, and the other hand you can use as leverage to open the lifted leg's thigh, getting deeper into that hip. Make sure both feet are flexed. Watch out for the rounding in the low back. Keep tipping the tailbone towards the bottom of the mat. This is super hard to do correctly. Really dorsiflex the foot, especially with your posture, but fight for it. Fight for that pelvic extension. Inhale, prepare. Exhale, arch that back, bracing the low abs. Inhale, use the arm as leverage to open the lifted leg's thigh out and away from you. Push out and away from you. Breathing here. Try to not hold the breath because that's not going to increase the flexibility. Couple more breaths. Using those breaths. After 2 more inhales and exhales, I'd like you to slowly make your way to the second side, setting up, taking that band. So this band assists. If you are able to reach your hamstring and pull it with your hands, then you don't need this band. However, most of the time I see when people do that, they're rounding their low back, and we don't want to reinforce that poor posture. Tip your tailbone back. That's what's causing that low back pain. So if you pull yourself into a stretch that you're not ready for, you can exacerbate pain. Tip the tailbone towards the bottom of the mat. Check out your pelvic position with one hand. Slide it under, create that space, lower the position if there's no space. Pull the abs in. Ujjayi breath. Keep going. Inhale. Exhale. And one more breath here. Inhale. And exhale. From here, we're going to roll off to one side, taking that band off, bringing that band around those upper arms again, making our way into downward facing dog. So what you're going to notice is once that band goes above the elbows and you send your hips back into down dog, your forehead is going to hit the band. I want you to push your forehead into the band to engage your neck flexors. Soft bend in the elbows, tuck the toes under, make sure the knees stay bent. Fight for some extension, that cow pose, arching your low back as you send your pelvis up. Push your head into the band, engaging your neck flexors. Walk your feet in a little bit. Looks like, tip the tailbone up, pull the low abs in, bend the knees. Inhale, head pushes into the band. Exhale, pedal the heels, bending one knee and then the other. Try to brace your abs as you do this. Inhale, exhale, and pedal. 2, 3, 4. Good. Inhale. Exhale and pedal. 2, 3. Tip that tailbone up. One more. Inhale. Exhale and pedal. 2, 3, 4. Gently lower the knees to the floor, taking off that second to heaviest loop band. Grab your second to lightest band. This is our green band in our set with the YouniquelyFit. And then you're going to grab your second to lightest Theraband. That's our red band. So we've got the green loop band and the red Theraband. You're going to take the red Theraband through the green loop band, and then you're going to lie on your stomach. So we're going to capture the same foot as our non-dominant hand with that loop band. So it's going to go around the ankle. And sometimes it's easier to get into from a seated position. Goes around the foot. And then from here, the same arm as the foot that you have the band is going to press forward in front of you, overhead press. So you want to wrap it around your hand so that you can give it a nice overhead press with that hand. There we go. Make sure it's around the foot and the foot's flexed. Otherwise, you're going to lose it. Dorsiflex the foot. There we go. Bend the other knee so it's in the same position. And from here, we're going to lift our upper body up, stretching our arms out in front of us. Inhale, lift up. Both arms hover in the air like Superman. And bend at the elbows. Give me 2 presses of the arms up here. 2 presses. 1 and 2. And lower yourself down. Exhale. Inhale, pressing up. Give me 2 presses. Brace the abs. 1 and 2, and lower down. Inhale, pelvis reaches to the bottom of the mat, pelvic floor pulls in and up, press, and 2, and lower yourself down. Switch sides, taking that band to the other side. So we're getting an active stretch for our quadriceps. We're working our low back in extension to combat that pelvic flexion. Make sure when you're in this prone position that your abs are in. You should not feel them pushing into the floor. They're always pulling in and up. Use your breath. Inhale to lengthen and push overhead. Legs are together or hip distance apart if you have back or knee issues. Give me that overhead press. Both arms up. Press for 2. 1. Lower yourself down. Inhale, pull the pelvis towards the bottom of the mat. Lift up. Arms reach overhead. Brace the abs. Exhale, press. 2. And lower down. And one more time, lifting up. We press, 2, and lower down. Stretch your legs out. You can release the band. Take your hands to your forehead. Wag your hips side to side, bracing your abs. Hips side to side, legs straight. And wag side to side. Great job.